This is a head-to-toe assessment of a newborn patient. So I'm gonna come in, knock, introduce myself to the parents. My name is Colleen, I'll be your nurse for today. We're just going to do an assessment. I'll verify the patient with mom and dad, and then I'm going to perform hand hygiene and close the curtain for privacy, and then come on over. So I'll get a birth history from mom. I'll ask if it was a C-section or a vaginal delivery and if the baby was term. I'll also get a set of vitals, temperature, pulse, and respirations. For vital signs, I'll measure for a full minute, respiratory rate, and then for the pulse, I'll do an apical pulse right here for another full minute as well. Now I will get the baby's weight, length, head circumference, and chest circumference. General appearance of the baby, skin is warm and intact. Everything appears to be symmetrical. Good muscle tone. I'll observe for any crying. As far as skin goes, vernix is a white cheesy substance that I see if the baby has or not. She might have milia, which are small white bumps on the nose or chin. Lanugo is fine body hair that is all over newborn's body. A Mongolian spot would be dark bruising, possibly on the lower back. Petechiae are little red pinpricks from possibly mom pushing too hard. And then erythema toxicum is body acne that the baby might have just from environmental exposure. Next we will start at the baby's head. I will look for the fontanelles, make sure they're not sunken or bulging. There will be no molding along the suture line, no caput, which is like generalized edema, and cephalohematoma, which is blood clots that would be on the baby's head. So next would be eyes. They are symmetrical. We'll look for color. Iris would be either gray or maybe blue. Initially when the baby's first born, then she could have a lazy eye, and then I look for signs of conjunctiva. Next we'll go down to her ears. They're in line at the bottom of her eye. I don't see any skin tags or abnormalities. They feel flexible and normal. Nose is patent. I'll check each nair to make sure. Then we'll go down to the mouth. I'll feel the baby's soft palate and make sure that it is intact and not high or hard or anything. I'll also look inside the mouth for Epstein pearls, which are little calcium deposits, and I will check a suck and swallow reflex when I observe the baby feeding. I'll also check the neck and clavicles, make sure those are intact, and there's no trauma from birth. Then we'll go down to the chest. Everything appears symmetrical. We have good bilateral movement. Nipples are appropriate size and shape, no extras. We will measure the breast bud of the baby, and then I will do breath sounds as well, again, and listen for any murmurs as well. Then we'll go down to the abdomen. I'm going to evaluate the cord for 2 arteries and 1 vein. I'll auscultate vowel sounds, which may be absent if the baby hasn't eaten yet. Then I will ask mom about valve movements, if she has passed the meconium yet, and any other issues voiding. And yeah, move down to genitalia. It would be normal if she had a little bit of discharge. The labia should cover the clitoris, and then if it was a male, I would make sure that the meatus is central. I would palpate the testicles, and check their location, and then look for rugae on the scrotum. As far as extremities, they're all intact. They move freely. Good muscle tone. Got all fingers, all toes. We can do the palmar reflex while we're here, along with the plantar reflex to see if they grip my fingers and if they curl their toes. Then we will also check her hips, good range of motion, good movement there. For the other reflexes, well, first we'll do her spine. So we'll check her spine and make sure her vertebrae are in line, no obtrusions or anything like that. We can do the trunk reflex, so we will just rub our hands down the baby and then see if she curves in that direction. Then we will check for a rooting reflex, so we'll rub the baby's cheek and see if she turns towards my finger. We'll do a startle reflex. We'll hold her and see if she's startled easily. With that, we will hold her up and look for a stepping reflex with her little feet. We can look for a positive Babinski sign, where you rub from the heel of the foot up to the toes and see if they fan out. And I believe that's all of them. Now for the behavior, I'll see if she has deep sleep and light sleep. If she is drowsy, has quiet activity, alert activity, and then any signs of intense crying that's out of the ordinary.